I think a lot of people don't, as Kerry rightly said, don't really understand how it's all financed. But what people are concerned about is length of time to get into an acute care bed. So which model is best for shortening that length of time that people can get into a hospital and get treated? Like 6 months for a knee replacement is not a good time frame. So how do we hurry that along a bit with the two models that we're talking about?
That's a $3 trillion question. And I have to start my answer by saying 6 months would be ideal for a total knee replacement. We are talking upwards of 2 years in a lot of cases here in Ontario and actually across Canada, specifically with COVID. I like to answer the question on multifacets. Obviously, money is at the guts of all of this. The assumption is that if we have an infinite amount of resources and money, that we will not be having this conversation. And we can address that in more details. But also, who decides that this particular patient is actually needing that care? And who decides to what level their care is urgent, and who decides, is it first come, first served? When the patient shows up to a surgeon and says, well, I have a knee pain, the first one is the first served, or is based on severity or based on their locations? And I have to tell you, this is a very complex problem of how the wait time is decided. Just to give you ideas of the symptoms that you will see, different surgeons, there could be 4 orthopedic surgeons in the same hospitals. They all can have differing wait times. Some of them can ask you to come back in 3 months, and some of them will ask you to come back in 2 years for your surgery to be done. And the patient would not have the visibility to this. And this is all within the same hospital. But if you can imagine across the province where I live in Oakville, and I have 3 to 4 different hospitals I can go to that are within 30 minutes drive or so. Every one of those hospitals might have multiple physicians, multiple orthopedic surgeons, and they all have differing time. How do I decide that I can't do the drive? I can do the drive as far as Windsor if I need to, if I'm in such a pain. But who gets to provide me that visibility? And as I mentioned to you, as patients, we may not have that visibility. There are tools existing that provides us that visibility, but many of us as Canadians are not aware of it. So that's one big angle in terms of the wait time, is that who is the surgeon and how well, what's their wait time. But also there is within the surgery, there's 2 types of orthopedic surgery if we're talking about the specific total knee replacements. There is ones that will tell you that you will need an inpatient stay in the hospital for 2 or 3 days to recover. And there are others that will tell you, no, you're an outpatient. You're actually not staying in the hospital. You are actually, as soon as you're up from your anesthesia, you're actually going to be out the door, and you'll be giving support to do rehab. And the majority of the cases is really the latter one. And this is really a factor of the model being pushed to lower the cost and lower the stay in the hospital. But it's also sometimes hospital stay is not the best thing for everybody involved, including the patient. So there is a fair amount of the patient being pushed out of the door because there is lack of resources to look after the patient in the hospital.